Hello, friends. Let's learn how to treat diabetes. Okay. Although this is a very vast chapter and there is no hard and fast rule what to use in the patient, but I have read few literature and from my experience, I will tell you very simple way to initiate drug at the first setting. Okay. Whenever you have diagnosed a patient with diabetes mellitus and look for fasting blood sugar, okay, and if the fasting blood sugar in the range of 126 to 199, okay, then you can use single oha, okay. I'm telling you mostly for type 2 diabetes mellitus because in type 1 diabetes mellitus it's always insulin, okay. Other oral OHA does not work there. In 200 to 250 range, you will need two oral anti-hypoglycemic agent, okay. If there is more than 250 of fasting blood sugar, then at that time you need insulin, okay. Why? Because whenever there is high blood sugar, it will cause glucose toxicity. What is glucose toxicity? Glucose toxicity means it will go and act in your the high glucose go and act on your beta cell, okay, beta cell of pancreas and destroys that, okay, and destroys the islet cells, okay, islet cells of pancreas, which will release insulin. So your body will be having low insulin. Although I think if you are watching this video to treat a patient with diabetes mellitus, the pathophysiology of type 2 diabetes mellitus is not decreased insulin. It is relative insulin deficiency, or there is insulin resistance, okay. In type 2 diabetes mellitus, there is insulin resistance. So that you might be thinking there's always increase in insulin because of their insulin resistance. Your bodies try to increase the insulin, okay, in type 2 diabetes mellitus. But initially, during the phase of glucose toxicity, remember, during the phase of glucose toxicity, because of increase glucose, there will be glucose there will be your beta cell will have toxicity, islet cells will have toxicity, and there will be decreased insulin production. So you need insulin in the first instance, okay. You have to remember this is a very good concept. After this, now let's learn what to use. For a patient diagnosed with diabetes mellitus, medical nutritional therapy, physical activity or lifestyle changes, and weight loss goal of 5 to 7% is very important. Okay. In After that, metformin use of metformin is advised. Metformin is a first line therapy in every case. Okay, first line therapy in every case, unless your patient has got deranged renal function test. If your patient has got deranged renal function test, then you should not use metformin. To be precise, if your patient has a GFR of less than 30 ml for 1.73 meter square, okay, then you should not use metformin as a first line of therapy. Otherwise, metformin is the first line of therapy. After that, if your patient is a patient of heart failure with CKD, okay, with GFR more than 30, you can always use SCLT2 inhibitor, SCLT2 inhibitor. Although, according to the drug in SCLT2 inhibitor, there is certain label when not to use. Okay, like there is GFR range when not to use. I do not go into detail. This much for today. Thank you. If you like my video and want similar type of video in future, please like, subscribe my channel, and you can comment for any other topic you like. Thank you. Have a good day.